Call the meeting to order. Start with the Pledge of Allegiance. Pledge allegiance to the flag
of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
It's like reverb. All right, we have no public comments. We'll move on to 4, approval of the February 7th, 2023 Public Safety Committee meeting minutes. Motion to approve. Do I have a second? Motion made and second. All in favor? Aye.
Aye.
Any opposed? Motion carried. Policy issues discussion, potential committee determination. You've all seen the packet. It was in the packet. I assume we all read through our packet. Do we want a discussion, or do we want a brief overview, or are we good? Body? Jessica's here if we want to answer questions, or if we want a brief overview. Go ahead.
Is the increase just because of costs going up? Or
Hello, is this okay? We have not raised our rates since 2015, and since then our operating budget inflation has gone up dramatically. So that's why we wanted to address them. Most counties throughout the state have been increasing their fees on a yearly basis after the legislation limitations. So we're just trying to get up to speed and trying to increase our fees to offset some of the additional costs through inflation.
thank you very much.
Go ahead.
Thank you, Mr. Chair. Just for foreshadowing what I envision the budget looking like over in future terms, I brought this up in our last year's budget discussion. I think best practice is really what Jess talked about. This idea that on a yearly basis, and the budget is the best mechanism to do that, the county board takes a look at fees frequently, as opposed to this, okay, it's been 8 years, we haven't modified the fees, and people are going to see a more noticeable increase. So my vision for the budget and working with HR Finance thus far has been to move to that annual review process. And essentially, my goal is to put together a master fee schedule for all of the fees that we require for the various services that we provide. So for example, with Jess's office, we'd have the fees that are in your packet referenced. And through your budget process, you would essentially approve on an annual basis those fees. The reason is quite simple. The fees, as Jess said, directly correlate to our budget. If we build a budget assuming a fee increase and then the fees don't get increased, we have a budget problem. We have a budget shortfall. So that's kind of how I see this moving forward. But to Jess's point, her office is a little bit in a little bit different position than a lot of our offices. The statutes that she referenced in her memo make very clear that the counties are very limited in what they can do relative to fee increases. Certainly, the last 12 months relative to inflation is significant, which in this context is important to consider with the CPI limitation that we have. But that, what you're seeing right now, my goal is to, in the future, I don't know that I'll be able to get it done for this coming year's budget, but moving forward, that idea of a master fee schedule for all departments in the budget.
No, I assume, and I'm just going to ask the question because I assume this is how it's going to go. We would just make a recommendation. This would have to go through the full board because it is a fee, correct?
That would be our intent, is to take it from this committee to the full board.
Thank you. So with that, go ahead.
So basically it's going to go up about 166.25 plus 16.25. Is that right? Oh, 16.25. Oh, because I thought it was 2 fees down here. Is that the same?
There's 2 different fees that we can offer right now. It's just a cremation authorization and disinterment permit. So a disinterment permit is any time a body that is buried is exhumed for whatever reason, there's a fee for that.
Thank you. I just wanted to get clarified.
And then those are the only fees that we can charge at this point with the legal limitations that most other counties have death certificate signing fees. And we initiated a death certificate signing fee when before the legislation came out. But unfortunately, the legislation was backdated past when we started the fee, so we had to get rid of that. But we're one of like 20 counties in the state that cannot have a death certificate signing fee.
So it's just 1625 then total? Okay, thank you.
Anything further? With that, I would entertain a motion.
I'd like to make a motion to take to the full board the proposal to increase the medical examiner fee as permitted by state law.
I have a motion on the table. Do I have a second? Second. Any further discussion? All in favor? Aye.
Aye.
Any opposed? Motion carried. All right, we'll move on. Thank you. Operation functions required by statute, ordinance, resolution, or policy. I was going to do the same with this one, but I assume I see the PowerPoint, so you guys want to do a brief discussion? You'd like to do a brief discussion on it?
I guess it's up to the committee if they review the information in the packet, whether they want further.
Would the committee want further discussion on this, or do you think what's in the packet's good enough for you? All right. With that, would somebody entertain a motion, I guess, at this point? Nobody wants to make a motion? Motion made to approve. Do I have a second? Motion made and second. Any further discussion? All in favor? Aye. Any opposed? Motion carried. Thank you. 7, educational presentations and committee discussion. Joint powers agreement between Marathon County and the City of Wausau for E911 and /NG911. I'll turn it over to Administrator Leonard.
Thank you, Mr. Chair. So the quick overview here, and I have Captain Milhausen Chief Deputy Milhausen here to provide further detail. But on an annual basis, Wisconsin law requires counties and municipalities that entered into joint powers agreements for purposes of emergency dispatch, that's the E911 and NG911, to execute what's called a joint powers agreement. And we have been doing those joint powers agreements, and I'll defer to Bill for how long we've been executing them, but it's required by statute. We're just making you aware that we're doing that. We're cleaning up that agreement. I don't anticipate, unless Corp Counsel has any opposing thoughts, that we're going to require substantial modifications to that joint powers agreement. But this joint powers agreement is specific to those E91 and next generation 911 services. And for those of you that have been on this committee before, you've likely heard the term joint powers agreement. And there's a lot of agreements that municipalities have and that the Sheriff's Office has with those municipalities relative to the provision of services. But this is statutorily required to come here on an annual basis. Not asking for action because, again, this has been something that the board has ratified in the past. Just making you aware if you do see any reference to it in the news or a reference to it at any City of Wausau City Council meeting, that it's a standard practice, not something new or innovative, contrary to your last item, which was the DA's office applying for an innovation grant, which they will do now. So, Chief Deputy, anything you want to add relative to our process and where we are with that joint powers agreement?
I guess the only thing that I would add is that historically, we have entered into joint powers agreements with all of the municipalities, and was brought to our attention recently that was probably a lot of extra work that we didn't need to do, because it only needs to be with those municipalities that we've had shared resources or combined services, such as the City of Wausau for the 911 service. So it's my understanding that that's the only one that we need to be entering into this going forward. Is that correct?
At least on an annual basis. Yeah. We can sign a longer contract for the other ones, but this one is one of those things you have to check off the box on an annual basis. And as Chief Deputy Milhausen referenced the reason for that, and Bill, I don't know if you want to talk a little bit about historically, we did have two separate dispatch services for the city and for the county, and like many things that the county is, that the state of Wisconsin is encouraging, and the way they encourage things is through the allocation of funds. They have been encouraging single PSAPs, or public safety answering points, throughout the state of Wisconsin. And through discussions with the city of Wausau a great many years ago, we decided to take that work on. So I don't know, Bill, if you want to provide a little history.
Yeah, I can just real brief. In the mid-90s, the agreement was that we would combine the 911 centers into one here at the sheriff's office. And at that time, the agreement was that the personnel that was with the city would come over to the county, and then they would bring over some of their equipment. And then there was a one-time fee, I believe, of $100,000 at that time. And ever since then, we've been the single PSAP for Marathon County, and we handle the dispatch services for all 80 entities throughout Marathon County.
All right, any questions? All right, with that, we'll move on to 7B, review of past discussions regarding emergency medical services, delivery challenges, and the county role. So we brought this, one of the supervisors brought this forward, obviously, last meeting, so we brought it on here. I don't think, has anything been really pushed on this at this point?
No, this was, if I may, Mr. Chair. This was, I believe Supervisor Marash, perhaps, nope, this was.
I brought it up when I talked to
Sure,
Tom
sorry, I
Association.
apologize. So I brought Phil here to talk and just give an update. This, like the public safety answering point and joint powers agreement, this is something that has been a long-standing topic of conversation. And Phil is going to go through and just kind of give you a lay of the land as to what is the county role currently relative to emergency medical service delivery. You've likewise heard from Chief Deputy Milhausen in the past on some of the things that the sheriff's office does in that regard. Not only how the system currently works in Marathon County, what the challenges have been, some of the things we've tried, and then the last part is to refresh everyone relative to some of the recent conversations that have happened at the county board level, but also the municipal level, about what the future might look like, because there are other modalities or mechanisms for delivering this service on what I'll call a countywide basis, but countywide looks different depending on what system you pick. But why don't you take it away, Phil?
Thanks. Good afternoon, Chair, committee members. I've been before you in the past to talk about EMS, and I don't have a lot of significant updates for you, but I thought I would talk today, give you an overview of where we're at and what some of the changes have occurred over the years, where we were a few years ago and where we are today. To begin with, just as a review, what is EMS, Emergency Medical Services? We have emergency medical responders in the county. We have EMTs. We have ambulances. They're primarily based out of 9 fire department-based EMS services. There are hospital-based services as well. However, they primarily do the interfacility transports. They don't do the 911 calls. The way it's delivered in the county are 3 different ways. We have volunteers, we have careers members, and we have combination departments. The volunteer departments are just that. People that are helping out their community, they're doing it for humanitarian reasons. They're getting paid a very small amount of money for it or some other compensation for it, but you might as well say they're doing it for nothing. They're volunteers. Again, we have the career fire departments. And then there are the combination departments as well, where we have a career fire department with paid on-call staff. Now, who oversees the fire and ambulance services locally in the state? For EMS agencies, it's the locals. Local municipalities do it. At the state level, ambulance services are overseen by the Department of Health Services. That's where their licensure goes through. For departments or fire departments, it goes through the Department of Public Safety and Professional Services. Now, who has the authority to provide EMS in the state? It could be a city. It could be a county, it could be a fire department, it could be a village, it could be a police department, and it could be a hospital. They may provide EMS. However, the townships have to provide EMS, whether it's through a contracted service or on their own. Back in 2016, I came before you in the committee to take a look at some of the issues that we were facing in the county. It was a request to do some fact-finding on ambulance services that were struggling to meet solid response times and looking for additional requests for mutual aid agencies, kind of an excessive request for mutual aid calls out there. I was to go out there and talk to the different EMS agencies to find out, just as a facilitator, to facilitate some discussions, is there something that the county can do to help out with these response issues? The findings that I came across were primarily related around, the core root of the problem was primarily around recruitment and retention. There was some issues related to training. There was some issues that were related to reimbursements. Primarily, it was finding members and keeping the members that they had. For whatever reason, new members were not to be found for the volunteer agencies. And when I'm talking about these issues, it's primarily the volunteer agencies. It's not the fire department-based ambulance services in the metro area. It's outside of the Wausau metro area. So again, they're having challenges with getting new members, and even with the members that they had, they're having a hard time keeping those members due to various reasons, whether it was lack of time, the amount of training that's been going on, the increase of business meetings, increase of other meetings, the increase in calls, whether they're emergency calls, non-emergency calls, and quite frankly, first aid calls where an emergency ambulance isn't needed, but that taxes or strains out the current members that were on the services. There was also quite a bit of issues with the daytime response for those folks that maybe lived in a village or a town, but they didn't work in that village or town, and they would commute into their job, but they would leave a vacuum of responders back in that village or town of where they left. That still exists today, and even if they did have an employer that was in that village or town that they lived in, some employers were hesitant to allow them to go off for fire calls or ambulance calls. Now, depending on what level of training you want to go, or a certification you'd like to go to, whether it's an emergency medical responder, EMT basic, EMT intermediate, or paramedic, wide variety of hours, but it is quite a commitment to get into those certification levels, along with the costs that that member or that person would incur along with that agency. As far as reimbursements go, the challenges they ran across there is if you are looking at the calls, whether it's an emergency call or an emergency or a non-emergency call on the ambulance services, and you look at Medicare and Medicaid as the primary funding source for these calls, you would know that Medicaid and Medicare do not fully reflect the cost of that call. They don't reimburse to the full amount that's needed for that call. Now, there is some supplemental funding that can be accessed through the state of Wisconsin, but it is just that. It's just supplemental. It's not something that you can replace your budget with, but that's primarily for training dollars as well. So that's what I found. And what were some of the actions that were taken? And the chief is here, and he could probably attest to it as well, that at one time, well, first of all, let me say that there isn't any statewide standard for response times. It's really up to the local municipality, up to that county on what they want to call a standard. We had an 8-minute standard at one time. It was kind of a rule of thumb that after a call was received by dispatch and that page went out to that EMS provider, they would have 8 minutes to respond to that call or a mutual aid request was sent out. We made some changes to that. We maintained the 8-minute standard as far as requesting a mutual aid call at the 8-minute mark, but we enhanced the amount of communication that occurred between the first dispatch and that 8-minute mark. For example, dispatch would send out a page for an ambulance service. Within a minute or two, they would call that ambulance service again, resend the page. At the 4-minute mark, they would call somebody from that service to find out if they're actually responding to the call. And if no one did respond or contact them at 8 minutes, then they would request that additional mutual aid call. Other changes. By the way, does that sound about right? Okay, thanks. One service did try an ELS intercept service or a concept to try to improve their response times and capability. That has since gone away. And the mutual aid box alarm system has grown, however, it has stagnated. And keep in mind that There really isn't a mutual aid box alarm system for EMS. That's more for the fire departments, not EMS specific, but it is something that could be considered. Now, a couple years ago, when we did our county strategic plan revision, after it was completed, we took a look at all the projects that were available in the county and reached out and got into a program called University, the University Alliance, and that was working with the University of Wisconsin-Madison, working with their students and with their staff to identify some solutions to all the projects that we had. For my particular department, the projects that we identified with the UW-Madison that they could work on was EMS retention and recruitment, EMS strategic planning, technical rescue team assessment, because at that time I had a technical rescue team, and finally a mass notification system enhancement. The students took a look at it over the course of a semester. They reviewed all the materials that we had given to them. They did some research, they did some interviews, and they came up with some recommendations for the two different projects, whether it was EMS recruitment and retention or the strategic planning. Their recommendations, to begin with, one was to resurrect what we called an EMS interest group. A couple of years ago, after doing the fact finding that I did in the county, I started up an EMS interest group. It was just nothing more than a group of EMS leaders, whether it was service directors or paramedics or members of EMS agencies, to get together on a monthly or a quarterly basis just to talk about EMS, talk about training, talk about protocols, look at equipment, talk about recruitment, all those issues that we were identified, and maybe they could get together and determine whether or not they could solve these problems together. Unfortunately, COVID kicked off right when we were getting our feet underneath us, and that group fizzled out, which was unfortunate because if there was ever a time to have a group together during a pandemic would be it. But they recommended that we bring back that EMS interest group. They also recommended that we send out surveys to the communities to get their perspective, the residents of the communities, to find out what do they think of their EMS. Is there issues with EMS? Is there something that they'd like to see different, or what thoughts they may have? They also recommended that we send out surveys to the providers, those EMS practitioners, the workers, to find out what do they think about EMS? How are they doing? Why are they leaving the service so quickly? And what's the challenges that they're seeing? And then our final recommendation was to seek out different labor pools, such as high schools, and implement a high school EMS curriculum. Not necessarily just to get EMS folks, that's the primarily focused on it. However, they were looking at possible healthcare workers as well. That's what we did last year. Now this year, you'll probably see me, or at least my budget, later on this year, a request for a renewal of a mass notification system. Currently, the way it works is that when we send out requests for an ambulance in the county or a fire department, someone will call 911 and they'll request an ambulance or a fire department response. Dispatch will send out the page. They will also at the same time, through the CAD system, send out a notification through what we call I Am Responding. It's a subscription service, and it's a mass notification service that will contact members of that fire department or EMS agency through a text message or other notification. So they get both the page and they get the notification on their phones. That subscription is ending at the end of the year. I would like to renew it for another 3 years at the end of the year. So that's why I'm saying you'll probably see my request in the budget this year. The other thing we could possibly do is take a look at an EMS feasibility study. Some of the options that may be identified in that study, depending on how this goes forward, is some options on how EMS is delivered within the county. Some thoughts that have been brought to my attention are we would have a countywide ambulance service, or we would have a countywide EMS agreement with the existing providers to provide service. Or we could take a look at whether or not the emergency medical responders could all become part of the county as opposed to the local municipalities. We would take control of that and we would actually dispatch out the EMRs. Or we would have some other service, just some options that are out there, or just go with status quo. But that's what that feasibility study would do, would identify your typical SWOT analysis, the strengths, weaknesses, opportunities, and threats. And that's what we'd be looking for. So with that, that's all I have. Do you have any questions for me?
If I can, maybe Chief Deputy Milhausen, if you have anything to add after a couple comments to add a little detail to what Phil referred to. You know, I think it's important to talk about when Phil referenced the kind of the challenges within that industry, EMS, the funding is a big part of it, and how funding is procured and what the reimbursement rates are. The reason when we talk about countywide emergency medical system and emergency medical services, that it's relatively rare. I don't know, Phil, if you know off the top of your head how many counties utilize countywide EMS, but there is a mechanism in the statutes where, and it's 660602 sub 3E sub 6, that allows a levy, essentially a levy limit exception. The costs that you would need to run countywide EMS is exempt from your levy limits, and all of you are very, very knowledgeable about, you know, the struggles that we have with levy limits and service mandates that are essentially unfunded. This is one of the very few exceptions that essentially, similar to a countywide library, it's outside of the levy limits, or debt service levy. It's outside of the levy limits. So that's why some counties have moved in that direction. I believe Wapaka is one. Portage County has some form of countywide EMS. But as Phil said, one of the areas that this committee has talked about for as long as I have been in administration is, hey, what can we do differently? What are those other options? Because right now, as Phil referenced, it's really locally led. And it's been that way for, again, as long as I can remember. We did one additional piece of information that kind of fits in with what Phil referenced. In 2021, I believe, we did have a couple of local municipal leaders. They started holding work groups because they were having challenges as well that Phil's talking about. This, it's recruiting, it's retention, it's funding. And they invited the county to attend those. I attended. I know Chief Deputy Milhausen, Phil, and now Sheriff Billup, he attended. And we heard that there was some desire, at least on the part of some of those local leaders, to have the county evaluate what might countywide EMS look like in Marathon County, because it simply saying something's countywide doesn't mean, I mean, on one end of the spectrum, you have their county staff, and we manage EMTs, we own ambulances, and on the other side, it could be something around along the lines of, hey, we essentially we manage the contracts for the delivery of the service as opposed to the municipalities, the unincorporated municipalities, I should say. So there was a desire and expression like, hey, you guys should look at that. And I know at Public Safety that was discussed. It was, in fact, brought forward as an item of consideration for my annual work plan. And as you know, it was in that second group of projects that, hey, not a priority for 2023, but a potential priority for future years. So again, this is not something that's new, a new area of conversation, a new topic of conversation, or a new area of challenge. I don't know, Chief Deputy Milhausen, if you have anything you want to add from the perspective of the Sheriff's Office and certainly as relative to dispatch.
Yeah, the only thing that I guess I would really like to add is I've provided this committee with some statistics regarding response times in the past. And the one thing that doesn't get captured in those response times when it comes to a conversation around EMS is we have, I don't know the percentage, but a very large percentage of the ambulances that we page out, we are paging a second unit for advanced life support unit to intercept with them on a vast majority of our calls. That is not captured in their response times. So when we talk about the level of service that is reaching the person in need, initially it is on most of the rural coverage areas, it's basic EMS service, and they're relying on additional intercept services for a higher level of treatment. Those entities, from my knowledge, that I know that have gone the route of countywide EMS typically are at least the paramedic level. So those are on board on that initial call that's responding. So when you're evaluating, or if you're evaluating those response times and what kind of service is getting to people in that amount of time, that would be one thing I would ask you to pay attention to, because that's what matters. The other thing that I would point out, and Phil made mention that municipalities or townships are required to provide or contract for their services. I've yet to go to an eastern or western towns meeting in the county where I haven't been pulled aside and questioned about EMS contracts. And I'll give an example. An example right now is the town of Gunther is covered by SAFER. SAFER's station that covers them is in Everest Metro's jurisdiction. On a good drive day, that's about 22 minutes to the southern end of the town of Gunther. So there's a big gap there, and I get asked why they can't request Mosinee or somebody else to come, and that's because we don't, from the dispatch perspective, it's whatever I have for a written agreement that's signed and entered into by those municipalities and those services that are being provided. So that happens throughout Marathon County. There's a lot of that where there's one where the Edgar ambulance goes, and they're on the far outside reaches of that coverage area, but it's only 6 miles from the Mosinee. So there's a lot of that. I don't have the answer for that other than strategically placing ambulance services throughout the county, but then you're still going to have your gaps. But that is one of the things that we hear that comes up. So that's the only couple things I had to add. Otherwise, Phil, I thought you did a great job.
Thank you. I had just two other things to build on what the chief was saying, and that would be two other recommendations from the university students. They recommended that we look hard at outreach programs to encourage residents to gain the knowledge on when they need an ambulance and when they don't, the difference between emergency calls, non-emergency calls, and an outreach to those services as well on when they're looking for that advanced life support ambulances. And the other recommendation was a triage, or that's probably the best word I could think of, triage at the dispatch. When the caller calls into the dispatch center, that there would be a matrix developed that from the dispatcher on whether or not this is an emergency run, a non-emergency run, or an urgent run. That caller would be routed over to a nurse or someone else who would make that determination whether or not they actually do need an ambulance, or if they need some other type of care, whether it's just help scheduling an appointment or making an appointment with their regular provider or some other means of transportation to get the care they need.
And just to touch on Phil's part with the emergency medical dispatch, if you recall, I came to this committee as well with that when I was advising that we would be not applying for the Next Generation 911 grant. That was a prong to that. We had to have emergency medical dispatch in implementation within 3 years of accepting the grant dollars. And at the current time, I came to you and told you that we weren't in a position to make that happen. That was about another $100,000 for that software and for the training, and then it's another about $30,000 a year ongoing for the training for the dispatchers. We have an old, I'll call it an old standby antiquated system right now that they utilize. It's a flip chart that walks them through the steps of dispatching to medical services or providing direction. There are far better latest and greatest out there for software, but it comes with a cost. So that would be something that would have to be considered if we look to go that route.
Go ahead, Al.
Thank you, Chairman. I was on that, in on those discussions, and I'll have to make an admission here. I am on the board of directors of the Safer Fire District. And I, over the years, have been hearing of some of these outlying towns which are held hostage to high contracts and poor service. So, you know, we got to go back in the Wayback Machine here. I think it was 92, 93. There was a study of countywide ambulance services. I don't know if a copy of that would be advisable to circulate amongst the committee members so they know what already had been discussed at the county level that was shot down. I was on the town board in Rib Mountain when we shot it down. At that time, we thought it was way too costly. But I want to see something to serve these outlying areas more efficiently than what they're getting now. And here, several years ago, we had an issue out in Edgar. And I don't think Rib Mountain was the main contract on that. But the first mutual aid was, I think it was Edgar, they couldn't respond. And then I forget who it went to next, they couldn't respond. Safer gets there, I think it was 37 minutes. And it was a hard issue. And I'm thinking, wow, we got to do something. So I'd like to see a continuance of, researching what can be done to serve some of the outlying areas, and of course, staffing and everything, and that's always an issue. But I support continuing the research and looking at what we can do for some of the outlying towns. Thank you.
Anything else to add or questions? Go ahead.
Thank you, Mr. Chair. I just wanted to kind of dovetail on a couple of things that were already mentioned, but the operational costs of these services, you would be surprised to see what the hourly rate is for people who are responding to these situations. Even if they're paramedic level, they're not always getting an hourly rate commensurate with their experience. So that ties into the recruitment issue, and also kind of gets to the point where some services are kind of intentionally building overtime into their approach so that they get a level of compensation that keeps people around. But aside from operations, and we are all familiar with fiscal pressures, towns, especially towns, their budgets are severely restricted. They have a hard time making their roads from year to year. So you get P-coat, but I think their road replacement cycle is something like 350 years. But the point is to say that they don't have a lot to work with. And so even aside from operations, there's things that if you continue to have personnel challenges, towns also don't have the funding to empower the services with things like a Lucas device or an assisted stretcher lift into an ambulance so that you're not having repeated sort of workers' comp injuries essentially from lifting people into the back of an ambulance. And if you don't know what a Lucas device is, it's something that very precisely does chest compressions during transit. So that would then free up the hands of an additional person in the back of the ambulance so that they could address whatever else is going on while the other individual is driving the ambulance. So even if you can find people to come up here, I think that you still want to look at things like that so that if you're looking at the outlying areas, you're able to empower those services with an extra person, so to speak. But if you don't have the funding to do that, then you're struggling to respond with the appropriate level of service.
Thank you. Go ahead.
So can I ask as a question to the committee? For additional investigation and work to be done, within the work plan, there was, we had it kind of earmarked that what we would do is go out and get an evaluation, put out an RFP, a request for proposals, for someone to tell us, hey, what might countywide EMS look like here? What would be a way to address the challenges that we have? Essentially do an analysis and come up with a couple of recommendations. If that's the desire of the committee, we're, as surprising as it might seem, we are starting the 2024 budget building process right now. So if that's a project that this committee deems a priority, as soon as you know that, I would appreciate that direction, and we'll be coming to the committees with kind of a revised, you'll see at the county board meeting in the future, a revised budget process where we talk about, hey, these are the timeframes when we want to get that information, similar to what I did last year, asking, hey, what programs do you want more of, less of, or new? or what do you want us to stop? This will allow for that conversation. But my sense is, if that's the desire, you want to have that project move forward in 2024. The sooner we know that, we can start to kind of put some numbers to what that might look like and get that in our 2024 budget building process. I know it has been a topic of discussion for clearly decades.
Currently, it's on the work plan, isn't it? But it was, like you said, just earmarked. We said it's not a priority, but something we want to keep on the work plan. Am I correct in saying it that way?
Yeah, it was essentially, the work plan was separated into two sections. The first section was, this is what we're going to focus on in 2023. And the second section was, these are things that we've talked about, but based on capacity limitations, they're not rising to the kind of the top to move forward in 2023. And we certainly then can, I've spoken with Phil, Bill, and Chad recently about, there were some municipalities that looked at consolidating public safety services in southern Wisconsin. And I know the four of us had the opportunity to review that report. And the first thing that went through my head is, hey, this would be great if this was something that they could do for EMS. And I mean, we could reach out and start to put some numbers together for that sort of evaluation. I want to be very clear, I'm not advocating for any one thing. This is as Supervisor Opel referenced, this is an item that is very, that locals are particularly passionate about.
I think that's huge. I was just going to bring that up. So depending on which township you go to, they're very over the top in their EMS or don't care much about their EMS. It's bizarre in my mind, but that is how it is. So I guess my thought process is we probably should go, I would say we would go to the Eastern and Western Towns Association, and we'd have to have some clarification as to, listen, we're not trying to take this over. We're just asking if we can facilitate better EMS service, utilizing, possibly even if they have a great EMS, we can use it, right? So I guess I would say I would say we would start as the Eastern and Western Towns Association. I guess that would be my thought process on that, because they're very, like you said, passionate about some of their fire departments. So. Go ahead, Al.
Well, in due respect to your request, I would ask Lance if he would want. What is proper? Are you asking for a motion or just a direction from this committee? And if you're looking for a motion, I would make that motion.
He'll do whatever we tell him, right, Lance?
Yeah, I will do whatever you tell me within the scope of the law always. It's not agendized for action. This is just an educational presentation. And we'll bring, through the budget process, we're going to have that engagement with all of the standing committees just to foreshadow for you that those conversations are coming. I think my sense is that it's not necessarily an either or track. If we want to incorporate it, if the board wants to incorporate it into the budget building process, you can direct me to do that in terms of finding funding. And at the same time, I certainly appreciate that some form of outreach to the municipalities that we're at least doing that work and having that evaluation done it makes logical sense to me, because as Chair Boots said, it's certainly an item of conversation at the local level as well.
So I guess how I would like to see this move forward, and I guess I'll ask the board if they're in approval of that, but I would bring it back next meeting with possible action. But in the meantime, we can do some research with the Eastern Western Towns Association and bring this as an actionable item of something we'd like to either move forward with or have something as far as if we're going to move forward, but we could move it as an action if we agendize that correctly. Did I say that right? Go ahead.
Is there like a possibility, taking a survey of the different towns to see, for interest-wise, see how many towns we can get or interest in partnership with the county?
Well, I think there's an education part to that, though, because if you just say, do you want countywide EMS? They're going to say, no, you're not taking my fire department away. That's going to be the outcome in my mind. So I think you have to have an educational element before you move forward. If somebody else disagrees with me, I mean, I think that's kind of a big deal for the townships. I think we'd have to have an educational type thing for them without just putting a survey. Maybe after that, that'd be a possibility.
Yeah, I think you're right. I believe that we're going to have some kind of educational and talk to people and you get their input, you know, and I think the biggest thing is, you know, they're hurting. You can, when they were preaching at us about it at the Western Towns Association meeting, they need help. And I mean, Marathon County is not the only county dealing with this. I mean, Lang Lake County, I think, is even worse shape. But it's definitely something that, you know, start talking to them and, you know, just say, hey, we're trying to make sure that everything, that we don't have holes here that nobody can fill, you know, just to have a conversation.
Go ahead, Bill.
Thank you, sir. I guess I would also just encourage you when you talk, consider when you go for an educational type presentation, understand that there's definitely two tracks within all of these municipalities. There's the town board, and then there's the fire department and the fire chiefs. Like has been already mentioned, if you go to the fire departments, unequivocally, you're going to hear they want their own control. If you go the other direction, you're going to hear a lot of them say financially from the county or the town boards that unequivocally they think some shared resources or combined resources. So just be mindful that I think if you do an educational piece, you need to engage both sides and then somehow put that data into some sort of a direction for yourselves.
So, Al, is there anybody else that has been a town chairman besides Al and myself? Yeah, and what you said is 100% right. There's sometimes is a miscommunication between what the fire department wants and what the town board wants. So that's huge, like you just said, so I can appreciate that. Go ahead.
Thank you, Mr. Chairman. We fought that battle years ago in the town of Rib Mountain, and it was a very, well, it was very, what would I say, controversial at the time. And I know of one community right now that is fighting that same battle. And so their fire department does not want it, and the town, or, well, town or village, whichever they are, but I won't mention the name. But it's, you know, it's, again, they were told by the board was told by the fire department, was told by the fire department. It's the tail wagging the dog. So that's all I have to say.
All right, so I guess that's what we'll do. We'll put this down as a possible actionable item. I'll talk with Administrator Leonard if that's okay with the body, just to put something together so we could possibly do something in the next meeting if we wanted to. In the meantime, maybe we make some calls. I can make some calls and, yeah. So, all right, thank you. We'll go to 7C, update on the Youth Detention Center.
Hello, I'm Kerry Plowski, superintendent of the facility. I'm not exactly sure the questions that were being asked to me, but I got a bunch of statistics, and maybe if you give me a little guidance, I can spew some numbers at you.
Give me 1 second.
I was the one that
Moran, yeah,
requested
yes,
this. So
that
what I
was-
was curious about was we had a presentation by, it was at the time Deputy Chief Billup, about how we were going to try to contract with other counties to see if they would contract for a certain number of beds so that we could reopen this. And then it just kind of, we never heard back about it. So that's what I was curious about. Thank you.
Well, we have 2 contracts with 3 counties. Oneida and Vilas signed a contract together, and then Brown County signed a contract for a yearly contract. Each county will pay us $91,250 for 365 bed days.
Well, that was easy.
Yeah, there was some admissions questions on how many. So last year we had 94 juvenile admissions, 72 were out of county, 22 were Marathon County juveniles. This year we have 37 admissions, 24 out of county, and 13 Marathon County juveniles.
Now, is it completely reopened to the, so you're holding both male and female, or is it just still?
Yes. Yes, we
Okay.
opened, we're both, yes.
Okay.
I have, if you're interested in last year's billing or how much we billed out to other counties.
No, we weren't even aware that it was reopened. So that was kind of the whole idea for me was, are we reopened? How did this work out?
We reopened October 18th. Yeah, we had 7 months of closure.
And I did talk with Sheriff Billab, this would have been a while back, and he said there was some other counties he had approached, or somebody had approached, I don't know if it was you or Sheriff Billab at the time, back when he was chief deputy, but he had approached them and they did not want to go to contract, but they did want to have beds. Well, they get charged out more money now that they haven't gone contractual. If I'm wrong, correct me on that, but I did have that discussion with them, which would have been a couple months ago, but.
Chair Boots, if I could just steal Carrie's thunder here for a little bit, just because I was privy to some recent conversations between the sheriff and myself, and you're exactly right. So we're struggling to get what we were hoping for contracts, the number of contracts. We're short of that mark, and the sheriff and I have contemplated. We have a $500, for those that are not contracted, we have a $500 a day fee. A fee chart just recently came out for all of those throughout the county, and I think we're about $90 above anybody else in the state with our top end at that 500. So we are exploring whether or not we drop that down potentially to the 250 range or something so that we can at least get some more people in the facility. I know the idea behind that initially was we would give a significant price break to somebody who signed a contract, but that did not come to fruition. So I think we're looking at some other opportunities now. I don't know exactly where that's going to go, but we're able to obtain a couple of contracts there, but far short of what I believe the sheriff had told you guys we were hoping for.
There are still counties using us at the $500 daily rate. It seems like we're taking more challenging juveniles, but we have multiple counties still using us at that rate.
Any further questions? All right, thank you very much. All right, we'll move on to 8. Next meeting date, a time announcement, and future agenda items. The one thing I did want to discuss, and just I guess it could be something that you could take to Sheriff Billab. When was the last time, Administrator Leonard, is public safety, when was the last time we had active shooter training? Because I brought that up, and I don't remember when the last time we did that.
I believe that was
Post-COVID, pre-COVID?
2017 or 2018. And it's interesting you bring that up. We have actually been having conversations internally about rolling that out, not only for courthouse staff, but actually all staff across the organization. So if there's a desire from the board to have a, for lack of a better word, a refresher on that, we can certainly put that together. But I recall the board getting that, I believe it was 2017.
And the reason I bring it up is I think we have quite a bit of a turnover since that time, so it might be something we want to look at. So that was just something oddly enough, I was in a conference yesterday, so it was brought up for schools, and I just thought I'd bring it forward quick.
Yeah, we're currently working with Mary Jo to schedule some training dates coming up here in the later part of the spring, I believe. I can't recall the exact dates, but I would think that we could probably definitely find a way to get the committees that want, or the full county board that wants to attend that for sure.
And maybe we just pass that on. I guess, Lance, I would ask to pass it along to Kurt and have that brought to the executive and see if other committees, what we want to move it with or not. But
That makes sense from my perspective to pass that along to Chair Gibbs, because I believe that was a county board, a full county board training that was offered. I can make note of that.
All right.
Thank you.
And then with that, committee members are asked to bring future discussion. Does any members want to have something for discussion? All right, with that, I will take, never mind, 8B, next meeting, Tuesday, April 11th, 2023, 1:30, and then number 9. Got a motion to adjourn? Second? All in favor? All right. Any opposed?
Aye.
Motion carried. Thank you, everyone.